Next, Policy Brief, a presentation of the policies of the United States government.
Ten years ago, then U.S. President George W. Bush established the President's Emergency Plan for AIDS Relief.
We'll devote $15 billion.
Universally known as PEPFAR. The idea was to fight the HIV/AIDS epidemic in the hardest-hit regions of the developing world, particularly in sub-Saharan Africa, where a diagnosis of HIV/AIDS was a virtual death sentence. Under PEPFAR, over the past decade, life expectancy rates for most patients in the developing world have begun to inch upward. Today, transmission of the infection from mother to infant is preventable, and deaths from AIDS have declined by more than 1/4 since their peak in 2005. New HIV infections have declined by nearly 20%, particularly among children. As of the end of September 2012, PEPFAR was directly supporting an estimated 5.1 million people on life-saving antiretroviral therapy. 10 years ago, the medical community's main concern was to slow down the spread of the AIDS epidemic, while its end was only a distant dream. But today, said U.S. Secretary of State John Kerry,
today, astonishingly, we are standing on the edge of the potential of an AIDS-free generation, because we know these diseases don't discriminate by nationality. And we believe that relieving preventable suffering doesn't need a justification.
That was Policy Brief, a presentation of the policies of the United States government.